Okay, so the first slide we have here is about the health and wealth in prisons, and it's kind of just an overview of the rest of our slideshow and our paper. So I just had a couple facts here about, how many people are actually incarcerated. So about 1,800 state and federal prisons are in the United States, and 3,200 are local and county jails. And in the US, we have more jails than colleges. 707 incarcerated adults in every 100,000 residents, so that's about 2.3 million prisoners, and that was in 2010 from the census.
The hygiene and health standards in prisons are not always great. 44% of state inmates and 39% of federal inmates reported a current medical problem other than a cold or virus. Newly incarcerated individuals are more susceptible to infectious disease and illness due to crowding of prisons and delays in medical evaluations.
We're responsible for providing constitutional mandated health care. Does everyone understand what that is? It means there are basically three minimal standards. One is that all inmates have the right to access care. Secondly, they have the right to care that is ordered. And thirdly, they have a right to professional opinions of those providers to order that care, such that the example that I give is that we can't have a dentist that tries to do an appendectomy. So that's the third piece of it.
In prison, inmates risk suffering from HIV/AIDS, hepatitis C, and tuberculosis. Also, the rates of hypertension, asthma, arthritis, and cervical cancer compared to the general population increase. Inmates also age faster, demonstrating the physical health of individuals 10 to 15 years older in the community.
Female inmates in both state and federal prisons report medical problems more than men. Men and women are equally likely to report having a dental problem. Female inmates in state prison are more likely to report a mental impairment than men. These include learning, vision, mobility, and hearing impairments. In state prisons, male inmates are more likely to be accidentally injured or injured in a fight. Among females, 4% of state and 3% of federal inmates said they were pregnant, and when they got admitted into the prison, they received some type of pregnancy care. Males are twice as more likely than women to die from either cancer or heart disease while incarcerated, and males are more likely to commit suicide than females while they're incarcerated. Aside from prisoners being tested for diseases immediately after incarceration, they should continuously be tested every 6 months. The purpose of this is to reduce the amount of infectious illnesses spread. With inmates living in such close quarters in an unsanitary environment, diseases can spread rapidly to a mass amount of people and potentially be contagious. It is not uncommon for prisoners to develop suicidal thoughts and start demonstrating irrational behavior while incarcerated. The number of suicides in federal prisons increases each year and is the number one cause of death in local jails. There are several recommendations to reduce the number of suicides in the future: communication and observation, screenings and assessments, and interventions.
Some ideas to improve health conditions in prisons could be to have each prisoner go through a medical evaluation immediately after incarceration. Prisons should also require certain sanitation standards of living and require vaccinations for influenza annually for both inmates and employees.
Wealth is also a problem in current prison systems. Even in prison, healthcare comes with a copay. Due to our constitutional rights, healthcare must be provided for all prisoners. However, there is a fee that they have to pay. 35 states authorize copayments and any other fee for health services. This might include emergency treatments and hospitalizations. 80% of prisoners are poor before and after they are incarcerated. When seeking medical treatment, payments often come from their commissary accounts, usually funded by families or their prison jobs. Prisoners at most receive about $20 a month. Spending it on healthcare could take away from their ability to purchase basic toiletries. This could be a positive and a negative thing. Requiring a copay could reduce the amount of time that prisoners are seeking care. However, it could increase their chances for communicable and chronic diseases. States such as California, Washington, Utah, Montana, South Dakota, Arizona, and Alabama have all had a price increase of 90% or more. These are just some of the larger states that have had greater price inflations in the past 7 years.